Welcome, Dr. Somi. I am so excited to be having this conversation with you, especially as we've connected earlier this year, and there has been a lot going on with HerMD as we're going to talk about. So welcome, and I'm really excited to dive in.
I am so excited. I feel like this conversation has been months in the making. We've been waiting to connect and catch up for sure.
Months in the making. Well, I guess that kind of brings me back to the origin and the birthing. We were also just talking about how we're both moms. And so really the birthing and the vision of HerMD, I think it'll be interesting to start there because you've had pivots, shifts, right? Going from in-person to virtual, and now the latest joining family with Joy and Blug. So maybe we can start off with the very beginning and kind of how, what really sparked the driving and the founding of HerMD.
I always say it was the call that was my calling. So it was my father calling me saying, Somi, you need to come home. My mother was gravely ill and she was only 45 years old, which is like mind-blowing to me now because I'm 50. She had been having left arm pain, shortness of breath, chest pain for weeks. And she had an abnormal EKG, and I was pre-med at Northwestern at the time. I remember looking at it, telling the doctor that it was abnormal from what I had learned in my pre-med classes. And they blamed it on caffeine. They blamed it on her children. They blamed it on stress. And obviously, you and I both know, being in healthcare, there wasn't enough science and data to explain why a thin, non-smoking woman would ever have four-vessel disease. She ended up having quadruple bypass surgery because she coded on the cath table, and that hence the call to me at Northwestern. And my dad said, your mom's sick and she's already they've already made the decision to take her to the operating room and you need to get home. And I remember promising myself, because I was pre-med at the time, that women were not going to face these barriers and basically this invisibility. So fast forward now through medical school and residency, and I joined my first job and saw 50 patients. And that idealism that I had, I was smacked in my idealistic face by the realities of our healthcare system. I was like, wait, this is broken for patients, but this is also broken for providers. So you and I both shared we're moms. So when the timing was right, and after listening to story after story of frustrations and dismissals and misdiagnoses and needless suffering, I was like, I'm going to open a practice where it's provider-centric and patient-centric, and there's magic in medicine, and we tackle things like menopause and perimenopause and sexual health care, and I'm going to do it in Cincinnati, Ohio, in an insurance-based system. And people were like, you're nuts. It'll never work. One person was like, why don't you just sell the idea to a hospital system, or your husband makes enough money. Why don't you just stay home? So I came home and I told my husband, I said, I'm either going to quit my job or this is what I need to do. He gently told me that I would drive everyone crazy if I tried to stay home. Cashed in my 401k, life savings, bought a building, opened a practice. A couple years later, women were coming from 35 states and 3 countries, and we knew we were onto something. I had 2 co-founders. They called it a blue ocean opportunity. I had to Google what that meant because I had no idea. Put together a pitch deck. They told us as 3 minority women. We had less than a 0.5% chance of raising capital, and we raised $10 million in 5 weeks.
Wow. What year was this? I'm curious.
We were raising in 21. We were funded in 22. And I opened the first location in 2015. We weren't seeing menopause on TV 5 years ago, and I opened this company a decade ago. And so then went through a couple oversubscribed successful rounds of fundraising, had a brick and mortar and a virtual that specialized in advanced gynecology, perimenopause, menopause, sexual health. We had imaging, phlebotomy, on-site surgery. I know it was crazy. When I think about, we were doing visualized biopsies, we were removing polyps. And, people are like, oh, bring a mirror so you can see, what's going on during your exam. I'm like, we had full-blown systems where women could watch their procedures, or we could videotape them and show them what we found in the uterus, like while they were awake, or they could be sleeping. People are like, oh, there's nothing we're doing for IUD pain. We had Pronox and conscious sedation and exam under anesthesia. I mean, we were so far ahead of the game because I love innovation. But anyways, so earlier this year, earlier in 25, the decision was made by the company to close the physical locations. The founders were able to reacquire the company. pivot, go from an integrated model to virtual only. And then, as you know, we just became part of a national platform, one of the largest women's healthcare platforms, by joining Joy Wellness, or getting acquired by Joy Wellness. So for this Ohio girl who started her practice based on a promise to her mother and a very frustrating experience with our traditional healthcare system, it's a dream come true.
Wow. There is so much there in what you just shared to unpack. So I'm curious, with your medical training, what was it like for you to step into the founder, wearing the founder hat, the founder identity, even if you had two other co-founders? It's, from my perspective, that's taking on a whole new being. And so I'm curious if you had to confront, anything within yourself around that, or because the calling was so full of conviction for you, that was all there was to do.
It was, it was like jumping off a cliff. It was so scary, but at the same time, so exhilarating. They say being an entrepreneur is like building a plane, or while you're learning how to fly it. So it was extraordinarily humbling, because as a doctor, I felt like, you're always learning. You're learning from your patients. You're always learning about new medications. So I was always humble as a physician and a forever student and teacher, but so humbling. I had to learn what a pitch deck was. I had to learn up basic vocabulary. I would get off with investors and not understand half the conversation. And so very humbling, very exciting. But I learned that I have this whole other part of my brain that I didn't know that existed. I was always a dreamer as a child. And so being an entrepreneur allowed me, the clinician and the dreamer, to coexist. That was amazing. The other thing I loved was the insight from being from the operating room to the exam room to the boardroom. They always say innovation dies without uptake. I was very good at helping innovation be adopted because I knew how to integrate it into the clinical workday. And I would finally say, being vulnerable, I dealt with incredible imposter syndrome. Like, who am I to be here? I'm just a doctor. Like, what am I doing in these rooms? What am I doing at this table? Like, I had to work with a executive coach. They don't do that in medicine. And I had people challenge, like, who do you think you are? You're a minority woman with no MBA. Like, why you? Why should you be here? So extraordinarily humbling. And like I said, I dealt with a lot of imposter syndrome.
Wow. And I'm sure founders who are listening to this, if they're earlier on their path, that will resonate and can empathize with that. I'm curious in terms of fundraising. I mean, that is a huge accomplishment. And I'm wondering, if you are able to share, what was it that made that first raise so successful? Was it a combination, right? Was it timing? Was it your background? Was it relationships? Like, I'm curious what really turned the corner on that front, because you hear and see very dramatic and roller coaster rides when it comes to fundraising.
So I would definitely say timing. 2021 was a very golden year to fundraise. I would not say that's all that it was. I mean, we checked all the boxes. We had product market fit. We had shown an incredible need. Healthcare was so far behind. There was all this innovation, but there was no access. I think women were hungry. And really at the front lines of demanding change. You were seeing celebrities coming forward and talking about midlife and sexual health care. All of a sudden you were seeing lubricants and vibrators popping up, and so I think that the environment around us was changing. I think women were frustrated. I think providers were frustrated with not being able to offer solutions to their patients. So part of it was luck, 2021, I'm not going to lie, right? But a lot of it was we checked the boxes. We were product market fit. We had shown women were flying and, driving from 35 states. And we had incredible brand affinity. Women had felt so alone, and HerMD felt like family. And so there was this magic amongst the providers and the patients and the community that we had created around HerMD that we removed, I would say, the painful parts of medicine, right? The parts that, like, women actually looked forward coming to the gynecologist. Like,
I can see
when
that.
you never hear that, right?
That's right.
And they actually liked coming because we empowered them with education and data and removed stigma, taboo, and shame. And we did events. And before, now we see them all the time. And so I think that was the mission and the magic. And the other thing I will tell you is, you can tell from this, is I'm a really good storyteller. And so I would make the investors feel and empathize with the patients. And so, yes, you give them numbers to show them your profitability, because I was profitable when I went into fundraising, but you catch them with the story, because everyone has a daughter, a sister, a mother, a wife who has gone through one of the diseases that we treat, whether it's endometriosis or PCOS or perimenopause, and they all locked on. They locked on to the story. And then when you combine the story with data and then all the other stuff I told you, that's where the magic happens. And that's why I get so many yeses.
Wow. I love that. And I mean, you are a great storyteller. Like, you just get to the point and it's so clear. Being so early in the space and being such an innovator, was it that when you first opened the physical location, did you have to do much marketing, being a marketer, getting the word out there? How did you find your initial customers, or was there so much locked up demand? It was fairly straightforward.
Oh my God, Destinee, the first 6 months, I think I cried more than I've ever cried my entire life, because I left a very good job.
Yes.
Cashed in my 401k and my life savings. And, when people are part of a big hospital system, they refer to their own gynecologist. So I had already been practicing a decade. So I had a lot of patients who followed me, but then it was just word of mouth, because I didn't have a lot of market. People are like, what's your marketing budget? I'm like, what marketing budget? So it was me and one NP and a front desk. I had bought this 3,000 square foot building, and I was like, what did I do? And then once it caught on, it was like wildfire. And then your patients, when you take care of them, they become your biggest, this sounds antiquated now because no one uses billboards, but they become your biggest advocates. Like, I had a patient drive 2 days from Florida, and I was like, how did you find out about us? And she was like, because we weren't advertising in Florida, an online support group for that, condition. She had had a stroke. She was suffering from low libido. Doctors told her, just be thankful that you're alive. Hopped in a car, drove 2 days to come see us. We diagnosed her with hypoactive sexual desire disorder. I gave her Addie, and she was better, and her marriage was saved, and she was no longer just surviving, but thriving. And it's story after story like that I felt like we were changing lives, and providers felt so good because we were able to give patients an answer and a treatment and a diagnosis. And I would say that because of our patients and our providers, that is how it spread like wildfire.
Wow, I see. So it wasn't, I'm assuming there was marketing when you first opened, or was it relying more organically?
There was marketing. My sister is my co-founder, and she has a master's in marketing. So she was a master at putting together a plan like grassroots, which was very much getting involved with the local providers so that they knew that we were going to play nice in the sandbox, right? That we weren't competition, we weren't delivering babies, but we reached out to the internist, the pelvic floor physical therapist, the endocrinologist, the oncologist, and then that way it became a two-way street of referral. We also partnered with like-minded local organizations, and we held a ton of local community educational events for all these. And so really got to be known that way. And then we also did a lot of philanthropic work. Like we collected, I remember period underwear. This is one of the favorite things that we did from our patients. And we took it down to Tanzania so that girls could stay in school and not miss school because they don't have access to menstrual products. But we used to pick an organization every month and got involved that way. It wasn't always global, but really became part of the communities that we were serving. And so, yeah. And then as we grew nationally, same thing, worked with like-minded brands that were serving the same patient population. And that's how we continued to grow. And then obviously we got a lot fancier with our marketing after that. But,
wow.
And my co-founder can speak to that.
I'm curious, if you want to go there in terms of the shift from physical location to virtual, because there was a lot of need in person. And what was the thinking behind it? Was it more based on the economics? Was it more wanting to reach more people? Probably all of the above, but definitely curious in terms of the shift to virtual and how that also changed the business.
Yeah, so definitely, as a physician, I know the need for physical. We were doing Botox injections for vaginismus. I told you we were doing on-site surgery, we were doing on-site imaging, but to have an integrated model of care when you wholly own each location is extraordinarily capitally intensive. And so I think the smarter model, this is all like, hindsight,
of course,
would have been to partner with organizations that have brick and mortar and kind of do a powered by HerMD model. And we initially had played with that idea where you go into these physical locations, you train their staff, you let them utilize their, and they own, but you kind of just manage everything for them from a branding perspective, education, training, because all of that is what's lacking, right? So going back, I think I would have done that differently, but it was definitely to be more capital efficient. And then we had wait lists in all the states we weren't in, and we wanted to get to all those women who needed the care. And then once we started back in 2015, there was none of these other companies. Then all of a sudden you have all of these other companies that started succeeding virtually. And we were like, okay, we've had a virtual platform for a while. Let's really double down on that, increase access, see more women, but do it in a much more capital efficient manner. And then leverage our relationships with our brick and mortar friends and partners and try to deliver care that way.
Got it. And that's been, how has it been productive? Has that fulfilled on the vision, with a shift to virtual? And then I kind of want to share about what's happening now and like what's next.
So definitely fulfill the vision, because I'm actually, and this was a learning point for me too, as a surgeon, because I'm so used to doing. I was actually shocked at how much talking we do as gynecologists and how much you can accomplish via telehealth and do it not only effectively but safely. And I know this because I see patients and I talk to them and they're like, oh my God, I just saw my gynecologist in person and I got so much more out of this visit. Like, you counseled me on cardiovascular prevention and bone health and, weight management and my hormones and genital urinary syndrome of menopause. And we didn't touch on any of that stuff. So I think you can be extraordinarily on telehealth if you are trained appropriately.
Agreed. And then you have partners that you can send your patients to for in-person care. Mm-hmm. Yeah.
Yes.
Love that.
Yes. And you have to know your limitations. I think that's the other thing. When people get into trouble is when they try to manage too much via tele. And really, it's time to call in that brick and mortar partner.
That's a fair call out. And do you have brick and mortar partners in all the states you're offering virtual care, or how is that currently set up?
See, so that we are now, we just got acquired by a national platform. And so it was mutually beneficial. They wanted our deep expertise in menopause, perimenopause, and sexual health care. And we wanted to leverage their operational infrastructure to be in all 50 states. And frankly, their belief in longer appointment times and basically patient-centric vision. So all of those details, we are still ironing out as the acquisition has just occurred very recently. Yeah.
Well, congratulations. When I caught the news and I knew that we were about to have this conversation, I said, this is perfect timing, especially with you shifting into the next chapter.
Yeah, and it is actually a big shift for me because in addition to the acquisition, after 2 decades, and this is where it's bittersweet. Everyone's like, how you feeling? I'm like, great about the acquisition. It's like watching your baby go off to college, my baby of a decade. But I'm hanging up my hat as a provider. And I think you're the first one that I'm saying this to out loud. So I am, people are like, is she going to be seeing patients on the new platform? I'm not. I have decided to double down on advocacy and education via speaking, via my book, via my podcast, The Disruptor, and really through training other providers and through my consulting work that I do.
Do you have a name for the book, or is that in progress?
Ooh, I have a name for a book, but I cannot share that yet because
Okay.
that's part of the magic. I would love to tell you. You probably fall out of your chair when you hear the name, but it basically talks about the fight and the gender disparity and how much it took to get adequate sexual health care for women. I had advertisers who would not, magazines that would not even put our logo in their literature because it said HerMD, gynecology, menopause, sexual health, or sexual medicine. And they were like, well, what if a 5-year-old reads it? And I said, well, first off, 5-year-old for being able to read that.
Yes.
But I'm like, what's wrong with sexual health? Like, there's nothing dirty about that word. So it's part memoir, but really breaks down all the domains of sexuality, because there's only 2 FDA approved medications for women's sexual health care right now, but really breaking down all the domains of sexuality. Like, sexual health is way beyond treating an STI or getting someone pregnant or contraception. It's about arousal, desire, orgasm, pain, satisfaction, all of those domains. And what are the evidence-based treatments that are actually available to women, and talking about the biopsychosocial model of sexual health care. And so there hasn't really been a deep dive like that written by a gynecologist, and I felt like it was missing. And I also felt like it was an anthem to this transformation that I had from patient and daughter to provider to founder to advocate. So all of this knowledge kind of weaved in through this storytelling.
I definitely want to circle back on this identity shifts in your life, because you shifted both personal, professional, and then also the business itself. And before we go there, I'm curious, because you mentioned, with the building of HerMD, there were a lot of community events and having people feel like they're part of a family. And I feel like that's so visionary, right? Because when you are innovating in a space, like we want to be part of a community. And now in-person events, especially with the rise of not just technology, but AI usage, is more important and critical than ever. So I'm curious, with this joining an expanded family, like, what's on the roadmap when it comes to events and community building, and especially in person?
Well, I know that I will continue to take stages and be at events, and we have some exciting educational events coming up to help train more and more providers, because there's one provider for every 32,000 patients. So we're going to try to alleviate the need there. And we're doing that with a partner with Kaplan. As far as Joy and Blokes, they have a very deep social reach and community. And we have a joint landing page so that all of our HerMD family can feel like they're part of the new community. So we will continue our efforts together through social media, and then I'll continue mine through speaking at these events, so that women are aware of what's going on with their healthcare and the latest innovations and what they should have access to.
Yeah, so good. So can we kind of maybe go back to your multiple shifts and pivots? Like, how have you been able to hold the conviction and stay clear on your journey? Because you've had so many shifts and so many changes. And, I know that, speaking from a founder, working with other founders, anytime you make a big decision, it's scary because there's risk. And you've made some huge milestone decisions along the way up until this point. And so I'm curious if there was a thread, if there was a pattern that was kind of holding you through all that.
I think what I've learned about myself is that if I'm not dreaming, I'm dying. And I think it's Barack Obama's quote, where basically, be the change you wish to see. And for me, I think it was the surgeon in me. It was, if there's a problem, I have to fix it. I can't rest until I do it. And, it's like you're climbing the mountain and the view keeps changing. And you're like, oh, because I thought the end all be all solution was I'll be a doctor for women. Oh, well, wait, the system's broken, right? Let me start HerMD. Okay, well, now women are coming from 35 states and 3 countries, and I only have 1 location. Well, let me be a founder. Let me fundraise. Let me do this. Well, this is going to be a lot more expensive than I thought, So I think it was not that I decided I was going to be all these things. It was like the universe put a blockade in front of me and said, well, this is the next problem. What are you going to do? And I heard in an interview, the only difference between a successful and an unsuccessful founder is grit. Like, a lot of people succeed the last time they try, right? And so for me, the transition transitions scary? Yes. Painful? Yes. Bittersweet? Absolutely. I am so nostalgic. I am the girl who loves Taylor Swift and Disney and all the cheesy things. I'm like, I'm macaroni and cheese, and I can be just as comfortable at a fancy, restaurant. And I'm a foodie and I love to travel, but I'm also extremely emotional, meaning I wear my heart on my sleeve and I lead with passion. And so anytime I leave something behind, it's not like I've closed the door, lit a match, and I'm like, peace out. It's always bittersweet, but you've learned something along the way and you've taught people along the way. And so for me, it's exciting, but it's pretty funny. My husband was pointing this out. He's like, babe, it's like every decade you get restless and then it's something else. And so I feel like I like growing something to the point where then it can survive on its own. And then I move on to the next thing.
Yeah, I appreciate that he can see that about you, and sounds like he also accepts it, because I know that I'm constantly reinventing myself, and it can be a lot for those in your lives, right? Because we're bringing some new things in and we're shifting and changing. So it's so great that he recognizes it, and sounds like he's super aware of it as well.
Oh my God. So he is, my husband's a medical oncologist. And so he's the roots, right? And I'm the wings. And you're right. It is difficult to be with dreamers and entrepreneurs. What did he tell me the other day, though? He is so funny. He was like, the scariest words in the English language are when you say, I have an idea. Because he's like, I know it's not going to stop there.
Right.
Then it's like, how much is this going to cost me? How many years is this going to take?
The headspace, the emotional weight.
We recently got a new puppy. He jumped up on a pool table and ate 9 chicken wings and needed emergent surgery. And he was fine. Everything was great. Okay. But I was leaving that day to do an event in New York City. And so my husband is got like an ICU bed basically set up in our bedroom. He's such a sweetheart. And I'm in this like fancy hotel. I'm giving a talk the next day. And he's like, I guess this is what it means being married to you and this dreamer. He goes, I am on puppy ICU duty for the puppy that you wanted, and you're in a fancy hotel in New York City.
Oh my
I felt
gosh.
so bad for him. But the whole point of that story is the sacrifices. Yes, the people who love us and support us, if it's our teams, whether it's our family, our friends, the sacrifices are huge. Like the things that I have missed along the way, the things that I wasn't there for during my medical training, while I was building my business, while I was fundraising, while I was, out on the road getting more recognition about, with HerMD. It's been a huge sacrifice. Yeah, it's not easy. So I don't want to tell any founder, I don't want to dissuade any female founders, but it's not an easy path.
That's right. I firmly believe that it's either your path or it's not. And it's some of that is built in, some of that is family, environment, and an ease with the path. But I 100% agree. It's like, this is your calling or it's not, but there's not really an in between.
And I think the other thing that I've come to realize is that if you're chasing it, it's really not meant for you. I think a lot of founders spend time chasing, and you don't need to chase. You need to focus on the things that you do really well and not clutter your head with things that will distract from your mission. The thing I tell my kids is this right here between your ears is the most valuable piece of real estate you will ever own. And you need to fill it with things that are like the magic makers, the believers, the supporters, and let go of the detractors, the negative thoughts. Like these are all things that I had to learn along the way. Even as a doctor, I remember if I had one negative review and 49 positives, I would spend 90% of my time thinking about the one negative review and how I could have, done better. And that the fact that I care is what made me a good doctor, but it also was not the best skill to have as a founder, because then you focus on the negative rather than the gains that you've made. Yeah.
That's right. I'm curious, before we wrap up, when you say chasing it, are you speaking to the wanting to push to grow faster, to grow bigger, or more chasing? Like, I'm curious what you mean by that.
I'm meaning chasing founder or chasing investors or opportunities that are not meant for you. I feel like the things that are meant for you and meant for your company and meant for your life, both personally and professionally, they are the easiest. Like the 3 co-founders, we couldn't have, I mean, my sister was one of my co-founders, so that was an easy one. But our other co-founder came from investment banking, and a marketer, a doctor, and an investment banker, like walk into a bar, that almost sounds like a punchline first, like a joke, right?
Yeah.
But it was our complementary skill sets that brought us together, and that there was so little, that almost felt effortless. Like it was so natural. So I guess if you're fighting not to succeed, but if it feels like too much of a struggle, then it's not meant to be.
This is an interesting point, because I often reflect on when you're hitting a chapter where it requires resilience to dig in, because it's not always easy and you're feeling all the big emotions and having to make decisions, versus, to your point, more of a lack of alignment and a lack of fit. And something that I reflect on is, how does one decipher between the two? Because when you're in it, it's not always clear how you see and categorize the two, because I do think that they're distinctly different.
Someone said to me just this morning, "You are so intuitive." And I think women are profoundly intuitive. I think it's why female providers have better outcomes than men. I mean, I'm going to say it because there's data to support it. But I think a lot of it is intuition.
Yeah.
Like I would meet someone and I would know they weren't a good fit. And I sometimes forced it. You know, I was like, well, no, it makes sense. And then looking back at it after it ended badly, I was like, I should have trusted myself. Like, why didn't I trust myself? I knew. I felt it, you know? And so I honestly would say intuition and then experience. Like, right? As I've grown, I've learned and I've recognized patterns and said, nope, that's not going to be good for our company or for us or for me. That has not worked in the past. And I think people don't trust that. And I also think the other biggest thing that I learned is titles don't entitle you. So remember we talked about imposter syndrome and how I had to get over that. And I was told that, you know, maybe a CEO with an MBA or somebody who, you know, came in with this experience was better to lead. And I realized that's not always the case. Leaders, that's a natural ability, and it could be the person next to you. It could be the person who reports to you. They can be a natural born leader. And so those are my answers to that. Like, that's how you know.
Love it. Love it. And it's clear. I think forcing it is such a great way to look at it. Well, thank you. This has been so good. Love this conversation. I knew I would, and it was even better than I expected.
Good. I'm glad. I'm
so
glad.
Good. Thank you so much for sharing your time, for sharing your wisdom, for sharing your energy. And I can't wait to see this out there.
Great. It was awesome talking to you.